Up to 54% of nurses and physicians and nearly 60%, listen to this, of medical trainees have faced burnout since COVID-19. But this isn't just about nurses. If you ask me, it's about anyone who gives, and gives until there's nothing else to offer. So in this episode, yeah, it's gonna be 2 episodes. I just want to show caregivers. If you're a CNA, if you're a nurse, if you're a parent, and a family member who is taking care of someone else, I want to show that burnout and compassion fatigue are real. I hope you'll be able to see how measurable they are and dangerous if ignored. I always say caregivers don't burn out because they don't care. That's not the point. They burn out because they care for too long without taking good care of themselves. But now the question is, what is burnout? That's the question. Because sometimes we use burnout and compassion fatigue as one or the same thing. But I want to see some differences through what I was reading. Hopefully it's gonna be clear. So burnout means your body and mind, listen to this, body and mind are exhausted from long-term stress. Long-term stress. You start feeling tired even after you sleep. Remember what we discussed on our previous episode 1 and 2? You start feeling disconnected and even hopeless. Now that is serious, right? It builds slowly. You know, if you're a nurse or a healthcare worker, shift after shift, day after day. For example, a nurse who works back to back 12-hour shifts, even 3, 4, 5 as we saw, or even more, sleeps 4 hours and still goes back in because she or he can't let her team down. A classic example of what we see. But now, COVID came and magnified everything. And there's some hidden cost of the pandemic that we rarely talk about. You know, we go ahead and say healthcare workers made a killing from COVID. Traveling jobs were giving out a lot of compensation, but they knew what they were doing, because this a lot of money that was being given out was hiding the actual cost of COVID. You know, it caused staff shortages. There are so many people left bedside. Fear of infection was real. And seeing too much death, I can't tell you how many people I saw die. And that created chronic trauma. It's like you feel numb. That is dangerous. Even after the pandemic, healthcare systems remain short-staffed. We know that. It's no secret. It's all over the world. Now, as we said, many caregivers, after that, now they quietly carry depression, they're anxious, anxiety, PTSD, and you won't see this because we show up smiling. That's the thing, the hidden cost of the pandemic. Now, what are the actual differences between burnout and compassion fatigue? Now, let's look at burnout. As we've said, number one, it's a slow build-up from stress and overwork. While compassion fatigue, it is sudden emotional crash after intense trauma or patient suffering. You are okay starting the shift, then suddenly you have this crash. You feel empty all of a sudden. Compassion fatigue. Burnout on one side, you feel empty and hopeless. Compassion fatigue on the other side, it shows up as anger, irritability, and emotional numbness. You know, until somebody asks you, you don't care? Because Because you've been numbed over a long period of time, you've seen patients going the same path, dying day after day, shift after shift. You are now numb. Okay? Burnout, another difference. Burnout on one side caused by workload, lack of rest, and guilt. Compassion fatigue caused by repeated exposure to pain or death. You see, they look so similar, and that's why we use them interchangeably, but there are some subtle differences. And compassion fatigue comes in before burnout because this one is sudden. Burnout is slow, very slow, subtle, and then over time comes this huge thing that you can't handle. Now, I can tell you, as I've said, watching patients die and you have nothing to do, resources are limited, you are short-staffed, everybody is struggling, striving to keep their patients alive. This one doesn't leave you the same person. You start having less hope with life. Faith in our practice reduces drastically, and you get to be numb. That's the saddest thing. Now, this is truth. This is not some stories out there. This is actual truth that is happening. And if you are a caregiver, you understand exactly what I'm saying. When you joined nursing school, when you joined medical school, and 10 years down the line, you are not the same person. Truth be told, you are a different person. You see life differently. You digest death in a different manner. You know how delicate life can be, how quickly life can just be nothing. So when we talk about burnout, compassion fatigue, it's not something that we should take with a pinch of salt. It is huge. It needs to be dealt with. And that's why we ask, why is it important? Why does this matter? Because burnout affects both you and those you care for. So when you show up at a shift that is short-staffed and you have not had enough rest, you are hurt, and even those you care for, your patients, are at risk. Your team members are at risk. When you are drained, focus drops and mistakes rise, and your license is at stake. Your source of livelihood is at stake at that point. So this is not just one of those things that we shove aside and postpone and delegate. No, these are the things that we need to handle, and handle right now. Families feel it too. I'm telling you, if you are caring for a patient, if you have a patient with dementia or Alzheimer's, doing the same things, and sometimes these patients don't even recognize you. You don't get support. You start getting impatient. You start having that emotional detachment. You start having withdrawal symptoms. They feel it. All right? Because in 2024, there was a study that was done that about 63%, now this was in the US, 63%, this is more than half, 63% of US healthcare workers say their stress levels are unsustainable. And I think it could be more. This was just last year. 63%. Unsustainable, what does that mean? What do we mean when we say something is unsustainable? How much longer are we going to move forward when something is unsustainable? When a patient tells you this pain is unsustainable, what does that mean? It means you're crashing any minute from now. All right? But now, I'm not saying this to scare you. I'm just saying this to create awareness that this thing for far too long has been shoved aside, or we have been desensitized to see that this is just a normal way of life. And now it's coming to haunt us. Now many people are leaving bedside, scheduled retirements, and it's not stopping. And many people are even getting scared of venturing into these careers. But now this is the wake-up call. Burnout is not a weakness. And if you have watched the last episode, we talked about how to know that you are burning out. It is a warning light. And as we all know, this old adage that says you cannot pour from an empty cup. Recognizing it early is the first act of courage. And if you have an accountability partner, if you have a friend, if you have someone who's close to you, they can be able to recognize it for you. They can be able to tell you, hey, you need to slow down at this point. That's why we need that community. We need to have this conversation going so that we can be able to recognize this, because who else is going to show up for us as caregivers? But if you feel tired, if you felt tired, if you felt numb, if any of this message gets to you and you're like, oh man, this guy is just saying how I feel. If you're feeling guilty for trying to rest, I want to say you are not alone. This is your sign to pause before your body forces you to, because when your body forces you to stop, nothing else matters. Now you need someone else to come and take care of you. The system is broken, the modern system is broken, and we can go ahead and blame the organization, blame the government, blame this, but at the end of the day, it is our sole responsibility to take good care of ourselves, not just for us, but also for those we care for. Now, I'm creating this safe group, a safe space for caregivers who relate to this thing and they need help. You need to talk to someone. You need some strategies. You don't know what to do. You are you've hit the wall. You don't know what you need to do because you've gone far too long. You don't even realize, what can I do to rejuvenate myself? Just comment reset. Follow me up on this platform, all my social media platforms, Facebook, Josh Mogash. Go ahead and text me the word reset. I'll share with you my free 3-minute. Now, this is the thing. I want to make it so simple so that it doesn't become something so that you need to postpone. A 3-minute reset guide to start your comeback. All is not lost. We still have a chance. And if you feel this information is going to help a caregiver somewhere, please share this video. Ask questions. Give your experiences, and we shall have this conversation going even beyond this episode. On our next episode, we shall now be talking what next? What do we need to do? Stay tuned for that one. Until next time, take good care of yourself. Bye.